Rajyeshwar Singh. Yeah, please. Dr. Anurag Shrivastava is there. Anant Prakash Tripathi. Anu Chaudhary. Kumar Siddharth. You're there. You're ready with your presentation?
Good morning, everyone. I'm Dr. Rajyeshwar Singh. So the paper presentation, the topic is clinical profile of primary angle closure disease. So as we all know that glaucoma, it's a chronic multifactorial optic neuropathy, ranks second leading cause of visual morbidity and blindness globally following cataract. It is characterized by optic nerve head damage and visual field loss, with intraocular pressure being the major risk factor. Despite its severity, up to 90% of glaucoma cases remain undetected due to their asymptomatic nature. So the aims and objectives of this studies were, the aim was to see the demographic profile of the subjects, clinical profile of primary angle closure disease, and the objectives were the clinical examination of subjects presenting with PACD and study the subtypes and evaluate the risk factors associated with PACD. So it was a hospital-based setup. It was done in Srimant Indresh Hospital, Dehradun, in a period of 18 months. It was a prospective observational study. The sample size, more than 50 patients were included in the study. So the inclusion criteria, all the patients aged above 40 years of age of both genders susceptible of PACD with or without normal intraocular pressure. Exclusion criteria, all the patients with aphakia, pseudophakia or previous glaucoma surgery, subjects with secondary glaucoma are to be excluded, as the staging of PACD is not possible in such cases. So detailed eye examination was done, detailed history taking including age, sex and literacy status, symptoms at the time of presentation, and visual acuity assessed using Snell's visual acuity chart. Refraction BCVA was performed. Slit lamp examination of the anterior segment and VH grading was done. Intraocular pressure was measured with both NCT and Goldman applanation tonometry. Angle evaluation was performed with indentation gonioscopy using ocular two mirror lens. Axial length and lens thickness were also evaluated. In posterior segment examination was done using non-contact stereo biomicroscopy with the non-contact lens, 90D and plus 78D diopters. And indirect ophthalmoscopy was also used using plus 20D diopter lens. OCT and visual fields was performed in the cases for the patient who consented for this. So the results, out of the 50 individuals, 24 for males accounting for 48%, and 26 for the female, 24 for females accounting for 48%, 26 for males constituting the 52%. Out of 50 respondents, 21 people were put in PACS, primary angle closure subtype, with 9 males and 12 females, while total 17 patients in primary angle closure subtype with 11 males and 6 females, and 12 patients in primary angle closure glaucoma with 4 males and 8 females. So out of the 50 respondents, the 21 stayed in rural areas, and wherein 29 people were staying in urban areas, so showing the urban dominance. Out of the 50 individuals, 42% were illiterate, and 58% were literate population. So these are the risk factors and the PACD grading. This following table shows the parameters of the PACS subgroup. The mean K1, K2 was 42.11 plus minus 2.20 diopters. Similarly, the mean axial length was 21.03 plus minus 1.56. Lens thickness was 4.52 and plus minus 0.74. and anterior chamber depth was 2.36 and plus minus 0.121, and age was 61.24 plus minus 11.36. So this is the subgroup of primary angle closure. The K1, K2 values were 44.18 plus minus 1.20 diopters, and axial length was 22.46 plus minus 0.42 diopters, 42 millimeters. Lens thickness was 4.54 plus minus 1.07, and age was 61.35 plus minus 10 years. So these are the values for the PACG subgroup. So the discussion in the studies, the study specifically sought to examine the subjects presenting with PACD, focusing on identifying and analyzing the subtypes. So Vijay Lakshmi et al. In their study concluded 54% of the 50 patients included in their study were belonging of the age group range between the 6th decade, and 58% of the patients were from urban areas, which was similar to our study. So Okansi S. et al. Examined the socio-economic backgrounds of the respondents, categorizing them in rural-urban settings. Across the total sample of 1,200 respondents, comprising equal numbers from rural and urban areas. The age distribution shows the highest frequency was observed above 40 years pattern. And our study delves into the retail ocular examination of 97 eyes, offering a comprehensive analysis of various ocular parameters crucial for clinical assessment and evaluation of the risk factors of PACD. So Ramanjit Sahota et al. Conducted to provide a synopsis of primary angle closure disease in India, resulted with axial length to be 23.49 plus minus 0.86 mm in control group, plus 22.88 in the PACG subgroup, 22.56 in the PACG subgroup. As compared to our study, which resulted in approximately the similar values, the statistical significance of these differences underscores the clinical relevance of our study observations, which were approximately similar, potential aiding and is better in the better understanding of management of angle closure diseases. So the study, in conclusion, the study population comprised an almost even distribution of male and female participants, reflecting
Rajyeshwar, can you just conclude?
So basically, the smaller axial length, the risk factors are smaller lesser axial length, increased lens thickness, and increased age, 6th decade, were potential risk factors for PACD in our study. Thank you.
So, what does your study add to the facts which are not already known as risk factors for PACD?
So first of all, this study was not done in the recent the 5 years of Uttarakhand, and to classify with the subtypes, and basically, sir, certain cases which go undetected, the screening was done, and the suspects were called for follow-ups after every 3 months, so that we can see if any changes are there, and so that we can prevent optic neuropathy in the.
You mean to say we have some more risk factors in area of Uttarakhand compared to like important
no sir,
like
no sir, it was just we were just trying to screen so that we can.
So what do you recommend? What are the screening tools that should be used?
So usually whenever the patient comes beyond every the vision and intraocular pressure measurement, we should always do a gonioscopy so as to know about the angles, and VH grading should also be done so that the undetected suspects can be educated, and we can be screened them.
Axial length measurement and lens thickness measurement also. We recommend doing this on all your.
Sir, if we suspect close angles in or narrow angles in the gonioscopy. Thank you, sir. Pardon, sir?
Out of 95 eyes, how many?
97 eyes, yes, sir. 21 eyes we saw primary angle closure glaucoma.
Is that common?
Um,
Like according to literature, do you think it's coming same?
Most around what, sir, approximately the same. Approximately the same. Suspects were more. Suspects were more. The maximum number was suspects.